Sometimes it's hard to face reality. Oh, oh, even though you might get mad at me. Oh, oh, sometimes it's hard to face reality. Don't be afraid.
What's going on YouTube? This is Logan Oren and I'm back with a new video. So today it's one of those sobering videos because I'm on my way to the doctor to have a biopsy, a thyroid biopsy. And you know, this is I guess coming off of it was kind of like I don't want to say it was a routine doctor's visit, but it was a visit that was it was for something completely different, unrelated to this. And, you know, while I was there, you know, I started talking to the doctor about, you know, these other things that were kind of bothering me. Like I had this, you know, kind of, mass, this little lump kind of thing that was on my leg, on my calf. And I went to the doctor like a year ago, and I went to urgent care because I thought maybe it was just allergic reaction. And the doctor, he was like, yeah, I don't really know what it is. You know, we don't have the ability to do an ultrasound or anything like that, or a Doppler, whatever the case. We don't have those capabilities here. So he gave me an ambulatory referral to go to the ER, and I went there, and, you know, they did like a little, basic kind of ultrasound, and, you know, they were like, yeah, we can't tell what it is. You know, unless we do like a biopsy or something like that, you know, there's no telling what you could do. But there is a more specific kind of ultrasound that you could get that would give you more detail than what they would be able to do in the ER. So, you know, they told me to follow up with my primary, and so I did that. And So I just kind of let it go. I didn't really, there were some other things that were going on, and those took precedent over, you know, that lump. And maybe I was a little worried because the doctor said, you know, he thinks it could be lymphoma, but I thought he said he possibly could have said lymphoma. And so, you know, I'm kind of like a hypochondriac, and I forgot what they call it now, but they don't call it hypochondria anymore, but it's something else that they call it. But whatever it is, I have that. So, you know, all it takes is for one referral or mention of something, and my mind goes completely crazy, and I just, you know, I go and I, you know, sign up for a schedule appointment with Dr. Google, and Google, of course, tells me every possible bad thing that I could, you know, figure out. So, you know, so I was telling him about that, and, you know, he was like, you know, well, let's do a more specific ultrasound. Let's do that go ahead and schedule that. And I don't know, but I sat there and I told him about, you know, my thyroid, like I have a goiter, and, you know, you probably don't know if you can see it, but it's kind of right here. And I told him, you know, yeah, like I've had this, you know, this goiter for like years, and since I think probably 2009 or 2010, because I remember it was like the first or second year after I was married, and I went to the ER because of like my blood pressure was really high. And so I went to the ER, and they did like a X-ray or something, or a CT scan, and, you know, they said, yeah, you've kind of got a little bit of a goiter there, and so maybe you should check it, you know, get it checked out. I really didn't get it checked out, because they said, you know, because they weren't concerned, you know, because like all of my thyroid levels were fine, and, you know, there was nothing that, you know, pointed to it being a thyroid issue. So they basically, you know, they basically didn't really say anything about it. They really didn't, feel that I urged me to look into it further. So maybe like several years later, and this is probably a few years ago, 2 or 3 years ago, and I was in another another doctor's appointment, and like I had noticed that it felt like that goiter was kind of getting a little bit bigger, and or maybe I just was noticing it more. I don't know, but I mentioned it. It was unrelated, and I mentioned it, and they basically said the same thing, that it's there's no real cause for concern. Sometimes people get goiters, and they have they have a goiter, and it's usually it can be benign and not really pose a problem. And his rationale was because my thyroid levels were all in, hormone levels were all normal, so they didn't feel like there was a problem with the function of there was an issue with the thyroid. So he said, pretty much, it's probably just a benign enlargement, and with those, you don't really need to do anything unless it causes problems, like, with breathing or swallowing or something like that. Then they can either remove it or do something. But unless there's an issue, they usually don't do anything where it causes other problems. So during this appointment, and I'm talking about all this other stuff, but then I mentioned, hey, I've got the goiter, and like, I've always wondered like what's going on, and but no one has has been concerned about it. And so I brought it up to him, and he was like, I can't even tell that you have it. He was like, you're already a bigger guy, you've got a big neck, so he was thinking maybe it was just muscle, but he said, I wouldn't have even known that you had a goiter. So he was like, well, let's go ahead and let's get an ultrasound, for it. And, let's see if, they can give us more information on it. So I'm thinking, okay, well, I've had all of these tests, I've had all of this stuff done, then it's just going to come back where it's just an enlarged goiter. So I, fast forward to, a week later or a couple of weeks later, after I actually have the ultrasound. I did the ultrasound on the leg, and basically it came out to just be, well, they did the ultrasound, and the diagnosis is that it's most likely lipoma, not lymphoma, but lipoma, which is just kind of like a fat deposit, on the body, and it can be caused by a lot of different things, but trauma. I think probably it's caused by like when I drive a lot. So when I'm driving, I have my leg is always like pushed up against the the little console, there's always like a little space, in the car, and my leg is always pushing against that. So I'm thinking that's what it's called. That's where it's from the constant pressure or pushing and bumping and rubbing against against it. And sometimes like it's uncomfortable, like I'm really putting a lot of pressure onto that, just because of the way that I have my leg kind of situated and targeted. But I pretty much thought that was that was for the most part that was it. After the that ultrasound, I had the ultrasound for the thyroid, and that came back, and actually no, I had the ultrasound for the thyroid first, and that's when I got the results back from there, and it showed that there were some nodules in there, on my thyroid. And so of course I don't really know what that means, but of course I go and I consult Dr. Google, and I kind of, I don't know, I basically like take the results from the ultrasound, and I kind of paste them into Google and see what it says about them. Because of like the size and the consistency of some of the nodules, they were kind of higher on the suspicious level, or the suspicious level, and so they recommended to have a fine needle aspiration, or basically it's a biopsy of those those 2 or 3, I think it is just 2 nodules that they want to do the biopsy on. And so that of course is concerning, and it is not. And when I'm talking to the doctor, and the fear isn't, okay, if it comes out to be malignant, that it's not an end of the world thing. So if, let's say, there's cancer in the thyroid, the doctor said, okay, well, basically, especially if it's not spread, but if it's if there's thyroid in those nodules, we can just remove the thyroid. You'll be on medication basically for the rest of your life, but we can get rid of it. So that's not an issue. But my concern, so after I did all of my research, my concern was the possibility of seeding. And if you don't know what seeding is when you go and you do a biopsy on tissue, and if it's cancerous, where they basically go into that tissue, and if it's cancerous, that there's a possibility that when you go into that tissue, then you can then spill out cancerous cells into the body. So what you ultimately do is that you're spreading the cancer, because when there's a cancer cell, when it forms the structure, the body forms a protective coating around it, and so it conceals the cancer cells, and that's basically the body's way of protecting you from that cancer. And so when you go in and you do that biopsy, then what happens is you basically tear into that protection, and then you can leak out you can cause the cancer cells to spread out into the rest of the body. So my fear is not necessarily it being malignant, but it's more so that, okay, well, if it is malignant, if it is cancerous, and it happens to spread because of the biopsy, that's where my fear is. And I guess I've been going in and out as far as like my the way that I have felt about the whole situation. I tried to be as optimistic. Some of the things from the research that I've done, there's some reassuring characteristics about the findings, and then there's some things that are kind of more so troublesome and more to worry about. So I try to hang on to those things that are, I guess you could say, that are reassuring, and I try to not dwell on those things that are bad, because ultimately, they're from everything that I look up and that I've researched, is that there is no definitive. The only definitive way to know if the nodules are cancerous is to do the biopsy. And that's what my doctor said, because my doctor knows how I am. He knows that I get very anxious about these things, and that I worry whether or not they're going to be, something's going to be worse than it already is. And he does a good job of reassuring me. Actually, all of my doctors have done an awesome job of reassuring me of things whenever something pops up. on, a finding or a test, then, when I go and I start Googling, they are very good about reassuring me about what the situation is. And so I was expecting and hoping for that visit, after we found out about the nodes, the nodules. And he, basically he told me, he's like, I wish I could be, more of a, more reassuring, but there's no way to tell with these things because he's seen, his share of situations with patients who, have like the same kind of things, and some of them turn out to be good, some of them turn out to be not so good. And so there is no like smoking gun to necessarily say that, yes, this is definitely, cancerous, or it definitely isn't. So, that's been the most worrying thing, is that there's just not a lot of there's no one specific thing that I can hold my hope onto, except for just the things that are present that usually are connected to be reassuring. So like the certain things, and I don't know how to pronounce it, but there's certain thing that, when I looked it up and it said, if it doesn't show this, typically that's looked at as a reassuring factor, but it's just something that happens. And it's also, it's what do you call it? It's very, frustrating that, my thyroid level, my hormone levels are good and they're fine. And, so it sucks that even when you have a normal functioning thyroid, then you can still, that it still doesn't rule out the possibility of certain problems like hypothyroidism, hyperthyroidism, thyroid cancer. All of those things could be possible with normal thyroid levels. And I'm like, that makes no kind of sense whatsoever. So how can you then say, how can you treat it if they are, well, I mean, I know how you can treat it, but it's hard to look at the reassurance when there's so many things that, you attest to or you cling on to the clinical symptoms or the certain test results and these things for a particular dysfunction of the body. And even though you could have a dysfunction in the body, but whatever the problem is, whatever the organ is or the body part is, could be functioning completely normal. So, that's, one of the rough things. So I'm on my way to do the biopsy. I was at work. I had to leave and, go to the appointment. My, boss, I came in the morning, and I told her, hey, I've got this, this situation. I've got this medical thing that I have to do, and, it's very important. So I'll have to leave. And, so there's some meetings that I'm going to miss while I'm at it. But it's a short thing. And, we'll go from there. I can only do what I can do. I prayed to God, told him like I didn't want to spend, hours and days, praying, because, he knows what I need, and he knows what I need from him and what I'm asking from him. And I've had, my brethren pray for me, and, I just am looking for, the hope that it's not cancerous. And if it is cancerous, then it's just I just have the hope that it is not that it doesn't spread when they do the biopsy. So we will see, and and I will continue to be optimistic and be faithful and have faith, and we'll see what happens from there. So I'll keep you guys in tune to what happens when I get the results. It's one of those things that because I'm connected to the portal, whenever the results come in, they actually come to me before it gets to my doctor. And my doctor knows that that's one of the I want to say my problem. That's one of the downsides of kind of how I operate, that if I have a test and I get the results, and I get the results, and so I'm going to want to know, I'm going to be curious. So I'm going to look at the results, even though I don't always know what they mean. I'm still going to look. And so, he knows that I'm going to do it. And I told him I wasn't going to look at it because I didn't want to worry, and I didn't want to, look at the results and then take them the wrong way and not know what I'm looking at and not know what I'm trying to figure out. But, in this case, I'm going to look at them because if here we're looking at a cancer situation, and, if, let's say, there is a possibility of spread, then something needs to be done like now and not later. And so I'll then have to push the issue. But that's it. I just pulled up and I'm going into the hospital to have the procedure done. And, you guys will find out, in a few days when I find out. So that's it. This is Logan Oren, the Troll for Truth. Why? Because the truth should mean something.
Trolls, roll out.